Hello and welcome to a video guide on the National Immunisation and Vaccination System, NIVS, used for the data capture of COVID vaccinations. NIVS for COVID is a point-of-care data capture tool for COVID vaccinations. The use of NIVS at point of care for COVID vaccinations is mandated. After viewing this video, you will understand how to access and use NIVS for recording COVID vaccination events. Access to NIVS for COVID can be achieved in one of three ways: registration through Insights, automatic contact and onboarding, and for current system users, requesting a COVID vaccination role. To register for NIVS, go to the NIVS webpage and click Register. This will redirect you to the Insights platform to complete the registration process. The following is a run-through of the Insights process. Enter your details, first name and surname, together with your email address. Select your job role, organisation type and your organisation. Agree to the terms and conditions and click Register. Once registered, you will be able to request access to the NIVS application from the list of available applications on Insights. We are working with trusts to obtain pre-approval lists of users requiring access. You may be contacted by email to set up your user security on Insights if part of this automatic onboarding. We will now go through the roles in NIVS, how to request them and how to switch to them once approved. Once again, go to the NIVS webpage and click Login. Complete your username and password and then sign in. For current users, to switch roles, click on your username to enter your NIVS profile. Select the Patient COVID or NHS Staff COVID role and press Submit. If at this point you do not have either role, you can request the role in your user profile under the Request Roles drop-down list, and once authorised, switch roles as before. Requested roles need authorising either from a pre-approved list or by contacting your organisation lead for authorisation. Our mailbox is monitored regularly, but you can prompt us by sending an email with the subject Authorisation Required. Now, how to use NIVS. Step 1. Check or load a vaccine batch. Click Batch and search to see if it is on the system. You can search by batch number, manufacturer or vaccine type. If one is found, you can edit it. If one is not found, you will need to add a batch. All of the fields marked in red are mandatory, and we not only need to record the batch expiry date, but also the defrost expiry dates of part defrosted batches. You may need to add further defrost dates as more of the vaccine is defrosted. Search for the batch, select Edit, and under Defrost Expiry Dates, click the Add button to add more dates. Now there is a batch recorded, you can start to record vaccinations using that batch. First, add a patient. Search to see if the patient already exists in the application by NHS number or patient demographics. If a patient does not exist, you will need to add the details by clicking New Patient. On this form, once again the mandatory fields are marked in red. Earlier I talked about the two COVID roles. The application has been improved to allow you to toggle between these two roles depending on who you are vaccinating, without having to switch roles in your profile. When Health and Care Worker is selected, 3 extra fields are required. All other information is required by both, so I will use this as an example. Search for the patient by NHS number. If found, it will fill in the demographics. At this point, you cannot amend them from the details returned. You can also search by the demographics for a spine match or employee number for NHS staff. The COVID vaccination programme stipulates that a vaccination cannot take place without an NHS number. You may have to use your local systems to allocate a new NHS number if required. Click Save and the patient is added, ready for vaccinations. For preloaded patients, to add a vaccination, click Patient from the main menu, search for them and then click Edit. This brings us back to Add Vaccination where we were before. At this point, the MHRA and vaccination programme have required us to add an interim page around pre-screening in response to a number of reported adverse reactions. These questions and guidelines may change over time, so pay special attention to this screen before proceeding. All mandatory fields are once again marked in red. If any prior vaccinations are found on the National Immunisation Management System, they will show here, but should never replace due diligence pre-screening requirements for clinical safety, but they can be a useful accompaniment to clinical safety checks. It is your responsibility to make sure the patient has had the correct dose at the correct intervals. Users should check with senior nurses if unsure. Please do fill in the prescriber and vaccinator details for data completeness, although these are not mandatory. Choose the pre-entered batch number, complete the site and vaccination dose, and remember to click Save. You also need to record any non-vaccinations and the reasons for not vaccinating. Click Save to finish. After a mandatory period of observation, or at a later stage, you may need to record adverse reactions. Search and edit patient, edit the relevant vaccination, and then click Add New Adverse Reaction. Once again, all mandatory fields are marked in red. Please remember to click Save. Let's review what we have covered. Accessing NIVS, log on and roles, managing a batch and setting up patients, pre-screening and recording vaccination details, and adding any adverse reactions. NIVS is a mandated application at point of care. It does not replace normal clinical precautions. NHS number is required in order to vaccinate. Any adverse reactions must be recorded. Thank you for watching.